TAVR is a procedure that's designed to replace the aortic valve. And there are situations where an aortic valve over time progressively will get narrowed and obstruct the flow of blood out of the heart. And when that happens, we need to essentially replace the valve. There's no other medical treatment or non-invasive treatment that will help a narrowed valve. So you have to mechanically open up the obstruction. And historically, the way this was done was with open heart surgery. And the surgeon would go in, open up the chest, cut out the bad valve, and sew in a brand new valve in its place. And over time, with technology, we've been able to develop a way to replace the valve without having to open up the chest, and it's all done through the blood vessels. And what we do is we take a valve, and it's collapsed down so that it could fit through small tubes that are then advanced to the bad valve. And within the bad valve, we're able to expand this new valve, and it starts working instantly.